and commitment to improving access to quality health service for all and building socially responsible generation through his vocation. He is currently working as a president of PHASOM. And as far as his education background, he is a BSc Pharma honors graduate. I would like you, Mr. William, to please take the floor and please welcome the participants and speakers. Thank you.
Thank you so much, Sonia, and thank you so much all. Once again, you're welcome. Next slide, please. Okay, so before we start, may we have some housekeeping announcements for the participants. Kindly please mute your mic and turn off your video. When you have a question, please use the chat box. Please participate in the poll as we want to know more about your interest. So we'll have 3 polls today or 4. Yeah, so please participate in all of them. The webinar will be recorded and will be available on the Empower School of Health YouTube channel. Please, you can go through it at some point. The slide deck will be shared with all participants. Kindly fill the feedback form at the end of the webinar so that we can get your details. You also be able to receive the certificate of participation within 24 hours. So these are just some housekeeping issues continuation. Please join the webinar at least 10 minutes before the start of the time. Please turn on your camera for a better engagement. Please mute your microphone when not speaking. Please adhere to the webinar schedule speaking timeline so that we finish within 90 minutes. Thank you. Okay, so here are some objectives. The main objective of the webinar is to understand and explore the career opportunities for pharmacists in global health and supply chain management. By the end of this webinar, the participants will have a good understanding of global careers for pharmacists, including access to medicines, procurement, and supply chain. This is the second joint webinar between PHASOM and Empower. And this time around, we are launching the Master of Science in Global Health, Procurement, and Supply Chain. There will be 2 programs, the 24-month program and the 12-month program, depending on your previous qualifications. Next slide, please. So now, members, participants, may we go through this poll, please. This is our first poll, so may we take part, or may we participate in this poll? Thank you.
I would request all participants to please participate in the poll. As you can see, there are questions and there are options to be selected. Please select the respective answers, and this poll will be for, you can put your answers, and this is active for a few seconds. And after that, we will be launching the results. So you can see that what is the maximum, like from which gender we have maximum number of participants, what is the age group, from which geographical region, and what it will be the academic background and work experience. So this will help us to know the audience better, that from which background we have received the large number of participants. So please participate. %62% of participants have already selected their answer. I would request others to please select also. "20 seconds left, so please select your respective answers. I can see the number of audience from, female audience are the maximum, that is 52% as of now. The age group is between 30 to 40. Yeah, so the maximum participants are from Malawi. So I know that this is from the help of Pharmaceutical Society of Malawi. I can see the academic background. The maximum is from pharmacy bachelor degree. I think we should stop the poll now and we will launch the results. William, can you please take it further to announce the results?
All right, I will take it from here. The results are as follows. 32 people responded and 17% are male. 17 out of the 32 participants are male, representing 53%, and 15 out of the 32 are female, representing 47%. The age group, 16 out of 32 are less than 30 years of age, representing 50%. And the 10 out of 32 are within the 30 to 40 range, representing 31%. 40 to 50, only 6, representing 19%, and no one above 50 among the participants. Geographical region, Eastern Africa, which is Malawi, is 19%, 19 out of 32, which is 59%. West Africa is 3 out of 32, which is 9%. Southern Africa is 2 out of 32, 6%. Central Africa, 3 out of 32, 9%. Elsewhere is 5 out of 32, 16%. Academic background, pharmacy technicians representing 16%, pharmacy bachelor's degree, 56%. With advanced degree is only 8 out of 32, representing 25%. PhD, no one on the platform, and non-pharmacy, no one among the participants as well. And other, there's only 3%. How many years of experience? Less than 5 years, it's a good number, 50%, which is 16 out of 32. 6 to 10 years, 8 out of 32, which is 25%. And 11 to 15 years is 5 out of 32, which is 16%. And over 15 years of experience is only 9%, which is 3 out of 32. Thank you so much. Those are the results of the poll. Please let us participate and also take part in the next poll that will be coming after some presentations.
Thank you, William, for announcing the results. Now I would request, since you all know that this is the event that we are launching along with PHASOM, and this is the second event that we organize together. So I would like William to say a few words about our partnership, since we have partnered from last 1 year, and it's been a huge activity that we both the organization are engaged with each other. So William, can you please take it further? And then after that, I will also speak few words about our partnership. Thank you.
Thank you so much for the floor. I will not say much since for more details, they are available on our website and the Empower website. So our partnership with Empower dates back to 2020, but we launched our first webinar last year, and we provided opportunities for pharmacy professionals to do the postgraduate diploma in global health procurement and supply chain. We offered one full scholarship to one candidate, and others got a partial scholarship. And also today, this is our second joint webinar, which we are all excited and looking forward that it will benefit pharmacists, pharmacy technicians, pharmacy assistants, and other health workers that are in Malawi. So this is a partnership that is getting stronger each and every day, and we are looking forward to more of these webinars and other activities that may benefit both parties. Thank you so much. Over to you, Sonia.
Thank you, William. And also, in addition to the comments that has been quoted by William, we have launched this partnership last year, and it's been 1 year now. We helped some professionals to help them to with their capacity building. They have enrolled to our courses, and since we have launched master's course also, so we will be looking forward for more engagement with each other now. And not only this event, we will be organizing more events in near future, out of which you all will be benefited. You all can increase your knowledge on the most demanded topic that will be decided or provided or asked by you. Now I would like to mention you all about Empower School of Health. About Empower School of Health. Empower School of Health is a capacity building organization and has worked over 100 countries across multiple languages to strengthen the institutional and HR capacity of global health and humanitarian program through digital learning. Majorly, our focus area are three, as you can see on the screen. The first one is leadership and change management. The second one is digital learning. And the third one is public health, procurement, and supply chain. The domain areas, you can see we have 5 domain areas as of today. And on the left-hand side, these are the clients that we have worked with or we are working with. We have already reached to or deliver nearly 1 million hours of capacity building content to nearly 2 lakh public health professionals globally. For more information, I would request you all to please visit our website. The link will be posted on the chat. As you can see that we have partnered with PHASOM. Apart from PHASOM, we have also get partnered with other institution, councils, societies, and universities as well. And this is the brief information about it. As you can see that we have partnered with HIPH, then Pharmaceutical Society of Zimbabwe, and other respective countries as well. These are the government bodies, UN agencies, donor agencies, academia, professional associations that we have worked with, we have partnered with. On this slide, you can see our advisors and faculty. Professor Paul Lalwani, he's Director Empower Group, former Head of Global Fund Procurement and Supply Chain Division. The fourth advisor and faculty is Professor Andy, and he is one of the speakers for today's event also, and you all will be benefited from his thoughts and his presentation. As mentioned that we have courses. As you can see, this is the list of the courses we have. Postgraduate diploma, short courses, diploma courses. And also recently we have launched master's course in global health procurement and supply chain management. This course is available this is basically categorized in 2 ways. This is first course is for 24 months for all participants, 12 months for the PGD graduates who have graduated from Power School of Health, and more information will be given by Professor Andy. Now I would like to hand over the platform or floor to William to introduce Dr. Felix, and he is our first speaker for today's event. Thank you all.
Thank you so much, Sonia. So as you can see, the profile is so long for Dr. Felix Cruz. Dr. Felix Cruz is a registered pharmacist and is a healthy economic pharmaceutical supply chain specialist. He has over 8 years experience of conducting research on pharmaceutical supply chain and quality of medicines in Malawi. Dr. Felix Cruz is a holder of PhD from the University of Malawi, a Master of Health Economics from University of Queensland, Australia, and honors degree from pharmacy in pharmacy from University of Malawi. Dr. Cruz has been engaged by the Ministry of Health and Pharmacy and Medicines Regulatory Authority in reviewing and drafting laws, policies, and regulations related to the pharmacy profession in Malawi. His career has been shared between hospital pharmacy, retail pharmacy, and pharmacy education. In pharmacy education, he He is involved in undergraduate and postgraduate training of students within the University of Malawi and supervision of postgraduate students registered with international universities. Dr. Felix Cruiser is a senior lecturer and current head of pharmacy department at Kamuzu University of Health Sciences, formerly College of Medicine under University of Malawi. He has won several research and academic grants, including the Carter Re-Entry Grant. So may I invite Dr. Cruiser to take the floor. Thank you so much.
Thank you, Mr. William Pute. Welcome all participants. I will mainly draw much on the career opportunities for pharmacists and pharmacy professionals. Much of my talk will draw much on what we are supposed to be doing when we are in the supply chain and the global health. In terms of the opportunities, Prof. Andy will take you exactly. So on a definition based, it's like when we say global health is an area whereby we are studying or the research which is practicing we are placing our priorities in improving the health and achieving equity in health for all people worldwide. So global health, we are targeting the people worldwide. We want every person, the poor, the rich, both of them having access to equitable health throughout the system. And supply chain is one of the areas whereby it has an implication in delivering quality health care throughout the world. If we go into the supply chain, we are looking at the whole aspect from chemical synthesis, product development, clinical testing, as well as up to the final end user. And at each and every aspect, there is activities which are involved. Majority of us here, we only see the actual product, but we don't see the other aspects of the supply chain. But our view should be broader enough beyond just seeing the final product, because all the activities are supposed to be part of the supply chain, and thus the knowledge of that is very necessary, because we can't help the patient if we don't have that knowledge. Next slide. Next slide. Yeah. So when we say pharmaceutical supply chain, we should look beyond the medicines, because a lot of low-income countries, the pharmaceutical supply chain is broader enough beyond the medicines. We are also looking at the medical supplies, laboratory supplies, and the radiological supplies. At the same time, they will also want the supply chain personnel to be involved in the movements of medical equipment from the suppliers or the manufacturers until they are all delivered to the patients. So if we see into this, supply chain is a complex requiring various individuals. So it's not an easy thing whereby we can say, okay, we are a supply chain specialist without necessarily looking at the nitty-gritties. It will always involve a wide range of stakeholders. And if we are looking at from the start up to the end, you will see, if anything, at any stage there is a mistake, it may affect the entire supply chain and customer satisfaction. For a private sector, that's a potential profit. For a public sector, it means a lot may be not only expired, but also out of stock, which impacts on the health of the population. And our target usually, which I always say, is the poor patient who doesn't know what is involved in between. The patient needs the medication right there and there. So any disturbances, it affects that person who really need the medication to get back to normal work and contribute to the economy of the country. Next slide. In terms of career opportunities, you can work in any of these careers, whether it's a hospital, but you can specialize in making sure that you are getting the necessary supplies to the hospital. Within that, you'll find that there are people who will be clinical specialists, but in supply chain, there will be people who are working in the hospital pharmacy, trying to make sure that the products are coming into the facility and they are getting the value for money. Sometimes you can work as a logistics and a supply chain manager at assistant level, senior or chief level, and also whether it's pharmaceutical supply chain or pharmaceutical supply chain advisor. These days, international organizations are trying to promote the low-income countries' supply chain systems, and then there are a lot of technical advisors being seconded to Ministry of Health in the low-income countries. So you can also work as a technical advisor, as well as you can specialize also in procurement and supply chain. So in this one, you are focusing mainly in trying to get the value for money for all the pharmaceutical supplies going into the hospital sector. For a private personnel, you are also involved in the wholesale supply. You are also a supply chain specialist within that. And academia, you are mainly in the teaching profession, trying to impart the new knowledge to the upcoming supply chain specialist. Next slide. If you go many details into the hospital pharmacy, much of your work will be quantifying requirements. And when we say quantifying, I think that's one of the biggest problems in a lot of low-income countries. We tend not to properly quantify, and then people in the end do not trust the data. But this data, if it's done properly, is very useful in the whole supply chain, because it will help us to properly know how to transport necessary medical equipments and medicines to the right people at the right time within the right frame, so that we save a lot of lives. Within that, you're also involved in the procurement as well as managing the medicines. Another issue which we always tend to forget in the hospital and also in all the supply chain is trying to reduce waste and expire of pharmaceuticals. Every year we'll see that the drugs will be expiring, but this can be avoided if we are applying some of the supply chain concepts like reverse logistics. Because reverse logistics, we are supposed to be able to identify things which may expire within our facilities. I'll give an example. In some of the research which I am implementing, I usually periodically will go to the health facilities, health centers, even the districts. You will wonder that maybe you have seen maybe a drug. I have seen some drugs which are antiretrovirals, which are expiring maybe next year, December. But from the look of their consumption, you will clearly see that those medications will expire before they are consumed by the patient. So the issue of reverse logistics is supposed to apply not only on those health facilities as well as a countries at large. And that's a duty of a supply chain specialist. Next slide. If you are in the normal other areas apart from the hospital, much of our work will be on oversight in the procurement or purchasing and negotiating the contracts, trying to get value for money. Those issues are in the supply chain specialists are supposed to be experts and be able to help in those areas. We are also supposed to be able to leverage our contracting relationship with pharmaceutical manufacturers, vendors, and suppliers. The main aim of this supply in the procurement is mainly to try as much as possible to get value for money. So whatever medications are being, the pharmaceutical are being purchased, we need to have value for money. So that's part of the issue which we are supposed to do as specialists. Next slide. We can also manage outsourcing other operations, because it's not that everything which we are managing are supposed to be done internally. Some of these issues can be outsourced, but we can use our expertise in trying to find a better fit within the model. Next slide. In terms of inventory, we are supposed also to be able to monitor and try and put systems which can be able to track the product. Because by the end of the time, we want the product to reach at the end user with confidence that the product will be quite right or not. If we are seeing how things are moving, I think this week or last week, the Pharmacy Board had to recall some of the insulin because of tampering within. That's showing that somewhere, somehow, our supply chain system may have had a problem in trying to track the product from the supplier to the end user. When I saw the pharmacy medicines regulatory authorities recall of the insulin, the biggest thing was, I think somewhere the supply chain somewhere we could not track within, because a normal supply chain should be able to track and be able to assure the quality from the supplier and to the end user. So if in between there was some tampering, pharmaceutical supply chain are supposed to be able to notify and do the normal audit and the recall procedures and manage the reverse distribution. And I think for that insulin, there will be a good reverse distribution procedure so that it gets out of the hospital back to the suppliers or back to necessary procedures before they are destroyed, because the insulin will be a harm to the population. That's a good example for trying to use supply chain in reverse distribution. Next slide. These are all the areas where supply chain can do: cost management, drug shortages, recall management. At the same time, some financial management and human resource, because when you are in the supply chain, you'll be also managing human resource who will be under the person, or you may be under a manager. So you need to know basic issues which can help you. And next slide. The next two slides, there will be the organizations whereby the examples where you may work. And I will not dwell much on the examples because Prof. Ande will take you on areas where you may be employed. So if you look at it, you see United Nations organization. These are just examples whereby you may work. World Health Organization, you said UNICEF, and much of the role will be either a manager, technical advisor, logistic manager, procurement advisor. But much of this talk will be done by Professor Andy Baraprof. Next slide. These are even non-governmental organizations in the world whereby you can also work. There are a lot of them where specialists can do. So all these will be in the realm of Prof. Andy Baraprof. Thank you. Over to you, Mr. Mpute.
Thank you so much, Dr. Kuluza, for the presentation. All right, our next presenter is Prof. Ande. So he's a global public health expert. He is the professor of public health and director of training at the Empower School of Health. Prof. Ande is one of the co-authors of the Yellow Book, Managing Drug Supplies by MSH and WHO, and the e-handbook of health systems in action. He has over 30 years of experience of working with major international funding institutions, bilateral donors, and the private sector in low and middle income countries. The main focus of the previous experience includes effective management of pharmaceuticals, vaccines, and medical commodities, and especially the implementation of programs for the introduction of the new medicines and rapid diagnostics for neglected tropical diseases. He has undertaken donor-funded activities in over 40 countries, from the provision of family planning commodities and responses to the early onset of HIV in the 1990s through the Global Fund grants in the 2000s, essential medicines provision in conflict zones, and extensive training on the quality of medicines. Most recently, he authored the GOARN Supply for Emergency Response COVID-19 Platform Pandemic Preparedness Training module. May I hand over the floor to Prof. Andy? Thank you so much.
Thank you very much for that introduction, William. Okay, so let's look now at the opportunities. Perhaps, first of all, the question will be, Why would you consider a career in healthcare procurement and supply chain? Many of you are already qualified. You're pharmacists or nurses. We've got a few doctors with us. Why would you want to go into supply chain when you've already chosen a profession? I think the answer is the recognition that all of us in healthcare want to deliver healthcare, and we can't. We're failing. We're failing our sustainable development goals. And one of the reasons is because our supply chains are not functioning correctly. Even when we've got the medicines, even when we've got the money for medicines, we're still failing to get them to the patients. Nearly 2 billion people, 30% of the world population, does not have access to medicines. And that's an absolute failure of our public health supply chain. And it's failing because we don't have people. We don't have enough staff with the skills and the knowledge to be able to operate public health supply chain. And we've got references on the screen from World Bank and other organizations to emphasize the need for people to work in the supply chain. Next slide, please. This challenge of human resource capacity is massive. We estimate about 70%. It varies a little around the world, and for Malawi and East Africa, it's a little bit different than other parts of the world. What we're seeing is not enough managers, not enough people with the advanced skill sets. In other parts of the world, we don't have enough of different kinds of staff. But really here, 70% shortages. We don't have enough people who know how to operate procurement and supply chain for public health. Next slide, please. And Global Fund, again, estimates 70% shortage of staff. And they go into more detail. This shortage of staff, because the staff we've got are underqualified and are not able to manage effectively, we get poorly managed supply chains. And then we don't get the health commodities. And we can't deliver modern healthcare, modern medicines without pharmaceuticals and health commodities. We're failing to achieve our major goals because we just don't have enough people. And that situation is getting worse. We have seen a 24-fold increase in the volume of new vaccines. Everyone knows about COVID vaccines, but there's many more new vaccines coming along. For Malawi, especially the new malaria vaccine. We're seeing a 5-fold increase in health commodities. How are we going to manage them? We don't have enough staff now. We need a lot more trained and skilled staff for the supply chain. Next slide, please. Well, why do we not have enough capacity? Why don't we have skilled staff? Well, basically because very few schools of pharmacy or nursing or medicine teach procurement and supply chain management. And very few management schools that do procurement and supply chain teach public health. It needs both skill sets. It needs a background in a clinical discipline like pharmacy or nursing or medicine or management, and it needs the other part putting in. So if you've trained in management, perhaps with an MBA, then you need some medical training. If you've trained in a medical discipline, then you need some management training to bring it together. The supply chain needs logisticians, and it needs a lot of them, but it needs them to be skilled in health, procurement, and supply chain. Just being a pharmacist is not enough. There is only one school of pharmacy in the world that teaches supply chain as part of its normal bachelor's degree, and that's the Hanoi University of Pharmacy in Vietnam. And that's because the government mandated a compulsory subject. They must take 1 month study on supply chain. so that they can enter government service. But most schools of pharmacies don't teach a lot of supply chain, and it is a complex subject. It requires management and specialist technical skills. Pharmacy alone is not enough. Next slide, please. There are many organizations involved in healthcare procurement and supply chain staff. And the point around this is to think outside the box. Everyone thinks about the Ministry of Health. Yes, of course, they certainly employ people, but so do all the donor agencies like USAID, like the Global Fund, all the UN agencies like UNICEF and UNDP, universities, many of the implementing partners like MSH and Comonix and Empower itself all look to need. There are many stakeholders involved. So as you look at the potential opportunities, look at the whole of the global activity. Many of the agencies like UNITAID, you may never have heard of before. They all need procurement and supply chain staff, but they need them with specific skill sets. Next slide, please. Well, don't take my word for it. Go and look at a few websites and check out the jobs. These are UN jobs for supply chain management all around the world. Check them out. But they are for people who are qualified already, who have that academic certificates, who have the skill sets. Without that, you can't enter. But there's jobs there. This is 1 to 25 of 325 jobs in supply chain management with UN agencies. That's a lot of jobs. Take time, visit the link on the screen, go and see the kind of jobs and the locations where they're available and see what your prospects might be. Next slide, please. There are jobs from the implementing agencies like Management Sciences for Health, MSH. This is the screen for their week. Comonix also have got jobs advertised. Here in Malawi, there are jobs being advertised. Yeah? MSH Global jobs being advertised. There are jobs there. You do not get these jobs unless you've got the skill sets, unless you have both management and medical backgrounds. And at Empower, we pull those together to give you a complete grounding in procurement and supply chain management. It is a specialist area. Next slide, please. Here are some jobs in Malawi, not all in the public sector, there's some in the private sector too. Worth having a look around, just checking out what the job opportunities are. Is it really true? Not some white hair old professor telling you. Go and check it out for yourself. Make sure it's really there and there's really opportunities for you. Next slide, please. So there are opportunities there, but it requires public health staff who are well trained in procurement and supply chain, or logistics managers who are trained in public health. We take from both sides. And most people who are working in this field, about 80% of them said, yeah, it was a good career choice. They enjoy it. But again, you have to have both skill sets. You have to have all of that information, all of that knowledge, and be able to implement it. Next slide, please. And the point around that is you need quality procurement and supply chain management training. And I'm sad to say there's a lot of very low quality courses around. The modern trend is, of course, for online training. It's the only way we can get the cost down and that you can follow a course while you're still in employment. We fully recognize that. But just putting a few slides on the internet is not online training. And yet we see many educational institutes and commercial bodies doing just that. The key here is it must be quality PSM training. And the starting point for that is, what's your current skill level? What's your current competency level? And at Empower, we have a tool which is free to use, where you can measure yourself and see how good you are in all the different areas of procurement and supply chain. And then you can decide if you need additional training, if you need additional skill sets. And the way that we undertake the training is adult learning. It's not like being back at school. It's not all talk and chalk with old professors talking for many hours. It's interactive, where you learn at your own speed, your own time, but in an adult way. And we follow the ADAE system of analysis. What is the problem? Design a solution, develop the solution, implement it, and evaluate how effective it was. So it's learning by case studies, by undertaking research in the field, looking at what happens and seeing the effect. Many of the training courses that are available online are not suitable for low-income countries. They've all been developed for high-income countries. If we look at the per capita spend on pharmaceuticals, in Malawi, it's less than $25 per capita, even with all the donor agencies. In the USA, it's $1,000 per capita. Yeah? They're buying 40 times more medicine than you. Yeah? It's a different approach to procurement and supply chain. All our courses are made for low-income countries. They're practical. They bring examples from low-income countries of the reality. We know how it is. We know how the warehouses are. We know the procurement regulations you have to work with. So, ADAE systems for quality PSM. But how can you be sure the courses are really quality? Next slide, please. We use a blended learning technique, some face-to-face, and that face-to-face is interactive online, so one-to-one. Web-based learning, of course, but also micro-learning with today's little message, 2 or 3 minutes on your mobile phone to help get the key points across. Virtual labs, where you can follow what-if scenarios. What if I do this? If I increase the stock in the warehouse, that will reduce the stockouts, won't it? Well, it might well do, but it will increase your expiry rate. So which is better? How do you find the balance? This is the virtual lab where you can follow these what-if scenarios. What if we buy more stock at one time? We'll get a lower price. But then what's the storage cost? Do I have enough warehouse space for all this stock? How do I balance the lower procurement price with the increased holding or stock price? We have adaptive assessments. Throughout the course, you're assessed. How well are you doing? How is it going? Multiple choice questions, but also case studies with answers. And finally, gamification. Playing games might not sound like studying, but it is an effective way to learn. You play a little game. What happens if I increase this stock? What happens if I reduce that stock? The game helps you plan, helps you think about the different scenarios and how they interact. Online learning is not just a few slides on the internet. It's a completely different approach to learning. And that's why you need a quality course, one that follows the needs of professional adults. Next slide, please. Certifications, well, of course, the Empower School of Health is accredited by ASIC, which is the UK University and College Accreditation Services, with ISO, with Kent State University, with INSEAD, with JSPH, with many other organizations. You can be sure the degree that you obtain, the qualifications that you obtain, will be recognized. Next slide, please. PSM is an exciting and challenging area, and COVID has made it even more challenging, but even more exciting. We have so much to learn from that. So much that we must adapt and bring forward. Not just the COVID vaccines, which is an immediate challenge for those volumes, but COVID disrupted the whole of our supply chain. We can't go back to business as usual. We have to be better in future. That means we must have skilled staff in order to do that. Next slide, please. Let's talk a little bit about the master's degree courses that we're offering. There are two programs, 24 months and 12 months. It's in conjunction with UNITAR, which is the United Nations Institute for Training and Research. So you can be sure this degree is approved by the UN. It's developed alongside them. And it's developed for low-income countries. And it brings a global health procurement and supply chain management approach. And we might ask, why do you need global? You're in Africa, you don't need global. Where do 90% of your medicines come from? They come from India. Well, okay, maybe we need to know a bit about India. But where does India get the API from? The active pharmaceutical ingredient to make those medicines? 80% comes from China. Oh, okay. So India buys it from China and makes the finished pharmaceutical product. But just where in China does this API come from? Comes from a city called Wuhan, which I'm sure none of you had heard of before 2020. And now all of you have heard of it as the place where COVID was first identified. So when COVID hit, it disrupted the whole supply chain. All the factories in Wuhan closed down, no API. India can't manufacture, there's no medicines for Africa. That's why you have to understand the global supply chain, so that in future we prepare ourselves for disruptions. We're ready. We're prepared throughout with different techniques for sustainable procurement and supply chain. There's a disruption, we're still okay. We've still got medicines. We're not running out of stock because we didn't know anything about global supply chain. We only know to place the order once a year on a tender. Different approaches. We need to learn about all the global health, procurement and supply chain. Who is this course for? Anyone who wishes to work in the area of public health, procurement and supply chain management. You do need a first degree to enter the course. It can be pharmacists, doctors, scientists, engineers, or management professionals, people that have undertaken management training, and we'll add some medical training into that area. Course for Ministry of Health, international NGOs, UN agencies, and international donors. And many of those join our course as well. It has a wide range of intakes. We have quite a lot of computer science people who wish to join the course. And they bring that specialist computer knowledge, and we add the medical and detailed supply chain training to it. We've had one Minister of Health join the course. I would recommend it for all Ministers of Health, but that perhaps a little political. But okay, everyone should understand how the procurement and supply chain works. Next slide, please. The course has two entry levels. If you have not yet completed the Empower School of Health postgraduate diploma course in Global Health Procurement and Supply Chain, then you enter a 24-month program. If you've already completed the Empower postgraduate diploma course, then you enter what we call the lateral entry, the sideways entry, a 12-month program. So 2 entry points depending on whether you've already completed the postgraduate diploma. You don't have to complete the postgraduate diploma. You can go straight into the master's course, but then it's a 24 months course. And that's an online course. So although we say 24 months and 12 months, you learn at your own speed. If you want to go a little faster, it's possible. If you want to go a little slower, it's possible as well. Next slide, please. What's included in the course? Around 17 modules with some options for specialist modules. The postgraduate diploma covers modules 1 to 9. So if you're part of the lateral entry, you've already done the postgraduate diploma, you enter at module 10, which is the emergency and humanitarian public health procurement and supply chain, and on through there. It does require a master's degree thesis. You will have to undertake some original research and write 20,000 words on original research, which will be marked accordingly. You will be given management training, as well as some medical training and a lot of procurement and supply chain training. Next slide, please. It's modern. We bring basic standard techniques and the latest modern concepts and methods, many of which are adopted from the private sector. So one of the areas is exponential smoothing. Many of you will know, if you're trying to forecast, you're trying to quantify how much supply to order, you will look at your past usage. Unfortunately, the past usage is often very erratic. It's up and down all over the place. How can I make any sense of it? If I just take the crude average, it could be skewed. And often our forecasting is not very accurate because of this skewing, because of the erratic data, the erratic information on the previous usage, the consumption profile that we have. So we introduce techniques for smoothing, not just taking the average, but we look at standard deviations for both lead time and consumption. How long does it take the supplies to arrive? That's the lead time. Well, this time it only took 2 months, but last time it was 9 months. Do I take the average? Does that make sense? Not really. So we look at these different statistical techniques. You can see quite complicated formulas there with square roots and exponential equations involved. So it's quite a challenging course to be able to complete that kind of calculation, that kind of information. We also look at concepts like the economic order quantity, almost totally unused in the public sector, but 98% used in the private sector. What is the best value quantity to order? The larger quantity I order, the lower the price will be, the unit price will be. Bulk buying gets me discounts. If I buy a large quantity, I get a lower unit price. But then I've got to pay to store it in the warehouse. So how do I get the balance between the acquisition cost and the holding cost? The more I've got in the warehouse, the greater the risk of expiry. And again, you can see quite complex formula here of square roots and exponential equations and some quadratic equations in calculating what that's going to be. This is quite advanced techniques, but perfectly normal for the private sector. Everyone does it there. It can be heavily computerized. A lot of it can be automatic. But it is important that you understand the basic formula and the basic techniques that are used. So this master's degree course is challenging. It is explained in a simple and practical way that helps people to understand. But you do need to have some previous training and be numerate in order to follow all the explanations. Next slide, please. We use real-life case studies from low-income countries. So we look at a particular country where it's been researched and documented, and we say, this is the situation, and this is what they did about it, and did it make it any better? You'll be expected to read this and analyze it and come to conclusions. Which systems worked well? Which implementing partners performed well? How did it look? What really went good and what went not so good? And what would work in my country? How would that situation be handled in my country? How could we do it? Because our situation is a bit different to this one. How do we come across the two different ones. How do we analyze information? How do we put it together? How do we draw up frameworks and key performance indicators to measure what's happening and to measure how well implementations improved, or perhaps they didn't improve the situation? And that's from case studies. So it's a lot of studying. It's not just listening to old professors talk. You have to look at the documents and learn to analyze. We'll give you the techniques, we'll talk you through the systems, but that's how you learn. That's adult learning, not all talk and chalk. Next slide, please. It includes the latest technology. How do we ensure the quality of our medicines? From the moment they arrive in the warehouse, we know they're deteriorating. Many of our warehouses aren't that good. We don't have good storage practice as it applies to the WHO GSP standards in many of them. We might at the national one and a few provincial ones, but as we get lower down into districts and certainly into clinics, there's not much there for storing medicines. How can we be sure of the quality of the medicine we're giving to the patient? Well, of course, we can take samples and send them for analysis. That's very expensive and it's very slow. Often by the time I've got the results, I've already used the medicine. What can I do to bring sense and timeliness into this situation of ensuring the quality of the supplies? We'll describe techniques like handheld Raman laser spectroscopy. See pictures of the equipment on the screen. I don't even have to take it out of the blister pack. If it's not a colored blister, I can take it straight through. And within less than 2 minutes, it will give me an analysis. It's not fantastic. It's not 98%. It's about plus or minus 20%. But for many medicines, that's good enough to tell me, well, it's still good, it's still okay, it's not dangerous, it's the correct medicine in the correct quantity. Yeah? And if I tweak it a little bit, I can get plus or minus 10%. And that's generally pretty good. So how can I use this technology? What is this technology? What is this Raman laser spectroscopy? We didn't learn about that at school. And how do we bring it forward in a management system that makes sense? This equipment costs about $40,000. I can't use one of those at every clinic in the country. So what system, what management technique can I employ to utilize this new technology to ensure the quality of my medicines, to make sure that the patient receiving all my medicines is right there, it's top class product all the way through. And that's one of the technologies that we talk about in the course, in the Quality Assurance of Medicine course, on how to undertake this 3-tier testing system developed by WHO, on how to schedule narrow therapeutic index products. And those with a pharmacy background can perhaps vaguely remember from 1 or 2 classes what narrow therapeutic index means, and how we go about defining these tiers for analysis. It's the kind of technique we bring forward, coupled with management. So it's not just new technology. Buy this machine and it will solve all your problems. No, it never will. Just like buying a computer won't solve your problems. You have to be able to use it within a structure, within a framework, within a management operation. And we describe those frameworks, most of which have already been developed by World Health Organization. Formal structures to help you guide through the whole system. Next slide, please. What's the impact of COVID-19 been? Well, people think about COVID. Of course you do, it's called COVID-19. But COVID-19 has seriously disrupted the whole supply of critical medicines. I told you about Wuhan and China and India bringing the medicines in. If we look at the survey of central medical stores in Africa, We see how many countries are in the danger zone. Nothing to do with COVID. Antiretrovirals for HIV have got nothing to do with COVID, but they're out of stock because COVID's disrupted the whole of the supply chain. We've got the system now where for our target for 2023 is only 15% of African countries will be out of stock. It's massively disrupted our supply chain. How are we going to rebuild our supply chain? How are we going to make it resilient and sustainable so that we never get into this situation again? We should have learned. We've had avian influenza. We've had Ebola, COVID. Now everyone's talking about monkeypox. Probably not going to be so serious, but all of them have got the potential to disrupt our supply chain if we don't build resilient supply chains. To build resilient supply chains, we have to know how the global supply chain works. And then we take local action on the global supply chain to ensure that we have enough stock for our patients, to ensure that in future we don't get this massive disruption. Next slide, please. PSM is an exciting and challenging area. I've worked in it for over 40 years. There are real job opportunities. The COVID pandemic in particular has highlighted the need that we must, absolutely must, have skilled and knowledgeable staff in our healthcare supply chain. But there's the rub. Those staff must be skilled and have the qualifications and experience. Just having a bachelor's in pharmacy, even a master's in pharmacy, is not enough. You have to have supply chain training, supply chain experience. The master's degree course will provide you with the ability and the confidence to operate in that area. Few points around the course. You do need a first degree. You have to be able to operate confidently in spoken and written English. We expect the French language course will come along shortly. You do need to be able to commit at least 25 hours per month. 25 hours per month. Yeah. Around 6 hours per week to do this. Some work experience is preferred, but it's not absolutely essential. Okay, next slide, please. I think I'm finished. Yeah. Okay, then I'll hand you back to William to go over to the poll. And I see I'm a little bit early, so we've got more time for questions.
Thank you so much, Prof. Andy, for the presentation. Now may we participate in our second poll for this afternoon. So please, participants, let's respond to the poll. Thank you.
Dear participants, please participate in poll 2. As you can see, there are only 3 answers. You just need to select 3 answers. The first question in poll 2 is, if you are a pharmacist, which area of pharmacy are you working in now? I can see the maximum is from retail pharmacy. Still, the figures are changing. So I would request others to please participate in this poll as well. The second question is, which type of organization are you working for? Majorly we have most of the audience from private sectors and Ministry of Health and other government bodies. The third question, have you previously worked in health supply chain? 65% says yes, 35% says no. 64% of participate has already participated in poll 2. I would request others to please also participate. We will wait for other 20 seconds and then we will end this poll as well. Thank you. We are ending the poll and showing the results to all. Yeah, as mentioned, if you are a pharmacist, which area of pharmacy, the maximum number of participants are from retail pharmacy, that is 30%, hospital clinical pharmacy 26%, then others pharmaceutical sales and marketing 9%, government 9%, health supply chain 24%. Which type of organization? 30% are from Ministry of Health and other government bodies, 20% from UN organization or NGO, and 41% from private sectors. Thank you so much for all your participation. We are now stop sharing the results. And we will move on to other slide. Now this particular slide needs to be taken care by me. This is the launch of master course. As explained by Professor Andy about the benefits, uses of master course, how this course will helpful for you to grow in your career and to help your respective region. So the Empower School of Health is pleased to announce the launch of Master of Science in Global Health Procurement and Supply Chain Management. As mentioned by Professor Andy, we have two categories under this course, 24-month and 12-month course. And we are launching this course in partnership with Pharmaceutical Society of Malawi. Since we have a good number of participants, and just for the participants that those who have presented in this event, we have partial scholarships just for you. So I will be explaining that how you can apply for the partial scholarship for master's course. The application procedure for applying the partial scholarship seats, that you can fill up your application form on the link. Please be assured that this slide deck will be shared with all, so you have all the important links with you. You can also get connect us at operations@empowerschoolofhealth.org and info@empowerswiss.org, and you can submit your request to PHASOM also. All the applications will be then reviewed by Empower School of Health and PHASOM. Selected applicants will then be informed of the application and registration process via email or call from our relevant team. This is the application form that we have on the website, not only for master's course, this is applicable for other courses as well. Whichever courses you are interested in, you can fill up your application form, then we will receive it and respective team will get connected with you. For paying the fee, for paying the fee, we generally have two payment modes. You can make the payment using bank transfer online and offline, and also we have a facility to pay via PayPal online transfer. For any partnership and for enrollment related queries, questions, you can get connected with me at operations@empowerschoolofhealth.org and info@empowerswiss.org. I would also request all participants, if you have any question related to the presentation that has been delivered by the speakers, or if you have any question related to the admission and taking enrollments and related to fee and how to apply for the courses, please put your question on the chat box, and I can see that few people have already posted, and those will be acknowledged by the speakers. Over to you, William. Thank you all for your time.
Thank you so much, Sonia. We'll be noting the questions. I have a question.
Okay,
the first one is.
Go ahead.
You can take it on, Prof.
No, go ahead. Go ahead. Yep.
The first question is, when is the deadline for applying for the masters?
The course will operate 3 or 4 times a year, so there's no actual deadline. You have plenty of time. It's not one-time application. It will be multiple times throughout the year.
In addition to that, we will be having first session in the month of June, and we are taking application for June session. So please fill up your application form going to the website of Empower School of Health, and you can also get connected with PHASOM. I can see that somebody is asked also for the cost of the course. So I would request you please write us to us so that we can share the brochures. And anyways, the brochure for master course will be shared with all the participants so they can have a brief information about it. But the fee that is mentioned on the brochure, that is the original fee. We have partial scholarship, and which will reduce the fee that is mentioned on the brochure. Thank you.
Okay, another question. Another question. As a 4 years doctor of pharmacy student, how can I develop capacity and competence in supply chain? Is there no place for undergraduate at all?
No, there are places. If you look on the Empower website, you will find there is a free course developed by Empower for UNDP. It is an introduction to procurement and supply chain management. Go to the Empower website courses, you'll find it on there. Try it out, that will get you started as the introduction. Okay. I think that was in the Doctor of Pharmacy course, yeah? For doctorate level, I would suggest undertake the competency skills assessment if you've already worked in the area, yeah? And then see what skills you want to strengthen and which courses are appropriate. In addition to the master's degree, there are many courses in specific areas. So you can measure your competency and say, well, I'm pretty good in supply chain, but I need more procurement. And you can take one of the courses in procurement only. So there's lots of options available. You start by measuring your competency level.
Thank you so much. Another question. Does the master's program also include CIPS qualification or accreditation?
No, it doesn't. At this time, we don't have CIP qualification or accreditation. They run separate courses. If you want that kind of accreditation, that's fine, but it's rarely focused on healthcare supply chain. It's a good course, it's a good qualification, but it is not specific for healthcare supply chain. Our course is 100% healthcare supply chain.
So I have two related questions, which I think have been answered already by Sonia, but I think maybe someone didn't get them properly. How to apply for the course, deadline and fees. And also another question, it says, what is the cost?
Okay, the cost is on the brochure for you from Malawi, and how to apply, you would just apply online. The instructions are on the screen, they're in the chat box now, how you can apply for the course.
Okay, another question is, I've already applied for the master's and also given the partial scholarship, but I wonder if the scholarship can be increased.
I don't think so, no. We've been already quite generous. We are a not-for-profit, but we do receive very little support. We have to try and at least raise some income. I know it's difficult for everyone to pay for courses, but I think the scholarships are as far as we can go. We can't go beyond that.
Hello, Sonia. So I'm already enrolled in the PGD course. Can I upgrade to master's course? And what are the fees nature like?
Yes, you can upgrade to the master's course. You need to complete the PGD first, and then you do the lateral entry into the master's course.
Another question to you, Prof. Andy, as well. Prof. Andy, what special actions do you think LMIC can take to reduce disruption in supply chain, especially considering the China, India, and Wuhan connection you brought? So I think this is more related to the presentation.
Right. Do you have about 2 hours to spare? But I'll just give you a couple of very quick ideas. Okay. One is around sustainable procurement. Right now, most countries do annual tenders and they make a 100% award. No one in the private sector does that. They always do split awards. So you increase your resilience by having more than one supplier. And that means more than one supplier from a different country. There's no point having two suppliers from India. If India is disrupted, it's disrupted. And there's no point having two suppliers from China. So you look at different routes. You look and analyze the global supply chain, and you will make different awards. The starting point is, what are your critical life-saving medicines? And there's rarely more than about 30 of them. And we look at those first. And we say, okay, let's do an 80-20 split. When we do the annual tenders, instead of 100% award, 80% to one supplier, 20% to another supplier. That already happens in South Africa. That's a normal part of government tendering. That kind of resilience splitting needs to be brought forward. That's one area. Another point is regional stockpiles. Many countries in Africa and in Asia have only small or medium-sized populations. It's difficult to store large volumes of supplies, but you can do that regionally. If we look around the region at Lesotho, at Namibia, with populations of 2 to 3 million, Botswana, it's very difficult to store large volumes of supplies. So regional storage hubs are a way forward. If you're Nigeria with a population of 250 million, you can have your own storage hub there in the country. We link with the private sector. Often the public sector is only around 40 to 60% of the medicine supply in the country. The private sector is doing the rest. If we link with them together, we can have shared buffer stock. We can have shared resilience. It's one of the many ways to bring it forward. There are lots of other techniques. They're described in detail in the course in around 3 modules, and I talk for many hours. Those who've already done the postgraduate course will be used to my voice, I'm sure. Okay, do we have another question?
Yeah, we have more. So let me take 2. Okay, let me say 2. The first one is, once enrolled in the 24-month course, is there certification provided if for any reason a scholar is unable to complete the full course?
I think we'd look at that. We don't have any formalized mechanism that I'm aware of for that, but we'd look at what might be possible, yes.
Another one, as an individual with over 10 years experience in managing health supply chains at nation and subnation levels and a holder of an MPH, is there an exception to allow, is there an exception to allow me to take the 12 months?
We don't have any formal procedure for that. I think we'd look on an individual case basis. It would depend on your personal competency assessment. You undertake the competency assessment. If you've already got a high degree of competency, it might be possible. But the 24-month course covers all the modules of the postgraduate diploma course. That's the grounding, that's the base material. If we don't have that, it's difficult. But I think we could look at it on an individual basis to see if it might be possible. We don't have any formalized mechanism.
Okay, for practical aspects of the course, does the program have special NGOs in which a student is supposed to learn from?
I'm sorry, can we say that again, please? I can't quite catch that.
Sorry.
Do we have
for practical aspects of the course,
yes.
Does the program have special NGOs in which the student is supposed to learn?
We don't have any special NGOs. We do have some case studies from NGOs that will be part of the course, that is part of the course. But we don't have any special NGOs. The case studies are based on the situation in a particular country. Sometimes that's with an NGO.
Another question is an interesting one, so I hope, okay, Prof. Ande, I'm concerned with PSM currently in Malawi. With the issues of forex, politics, how can the master's program help to sort out such scenarios?
There are limits to what we can achieve even on a master's degree course. Let's start with the easy politics. We can't solve your political problems, but we can give you frameworks and guides on how to interact with politicians. For foreign exchange, again, we can't solve your foreign exchange problems, but again, we can give you guides on a few leads on how you might go around making it a little bit better. There are limits. We cannot solve all the issues, no.
I think the last one is about, do we have a French batch for this? So I think that was already answered. You may just re-echo.
Yeah, not yet is the answer. Coming soon, we hope.
Right, there are no any other questions in the chat box. Yeah, so I think that's all.
Okay, then point.
Thank you, Professor Andy, and thank you, William. For any other questions, please write us. So we will get the answers collected from the respective speakers, and that will be provided to you. For any related questions related to course enrollments fee, I have posted the email ID. Please write on that email ID, so we will help you out. Now, this is the time for third poll. And this is the last poll of this session. I would request all to please participate on it. The first question is, are you interested in career in global health supply chain? Please select the respective answers. So we will show the results to you, and this will really help us out to analyze this event.
Let us respond this poll, please.
Participants, please select the respective answers. This will be not so long poll. This will be activated for just few seconds. So you just need to select the respective answer, and we can go to closing the session. As of now, 40% have been participated. Are you interested in careers in global health? 93% says yes, and 6% says I'm already in it. How did you hear about us? Through Pharmaceutical Society of Malawi, the maximum percentage, that is 53, empowered, that is 38%, and others 9. How did you hear? Okay, which channel? So 30% through email, 43% through social media, and others 27%. You are a member, alumni, staff of University of Malawi, 45%, Empower School of Health, 26%, Society and Council, 64%, FIP, 10%. I can see, have you taken any course from Empower School of Health? So I can see the maximum percentage says no, not yet, but I'm interested. So it is high time to get yourself enrolled to the course. How did you find this webinar? Very useful, 93%. Thank you for your feedback. And we will keep improving our events, future events, and that will be communicated to you all. Now we will end this poll. You can see the results. Thank you all for your participation. Now we will just go to closing the event, and just do not forget to download your certificate of participation. The link is posted on chat. Please fill up your form, and the certificate will be sent to your email, registered email ID. In addition, the recording link, the session is already live on Facebook. So whenever you want, you can visit our Facebook page. Also, the presentation will be shared with you via email. Thank you all. Over to you, William.
All right, thank you so much. So I think we have seen the poll results. As Sonia has said, yes, 93% are interested in the career in global health and supply chain. 56% heard about this webinar through PHASOM, and 36% through Empower. Yeah, so those are the poll results. Have you taken any courses with Empower? A good number of us have not yet to take one, so it's like 58%. Yeah, how do you find this webinar? So 93% found it very useful. Thank you so much. Those are the poll results. So I think in closing, I would like to thank Prof. Ande, Dr. Kuluza, Empower and Sonia, and everyone else from Pharmaceutical Society of Malawi and all the participants for taking part in this session. Thank you so much. Please remember to fill in the link so that you can get your certificate and other communications from both Empower and PHASOM. Thank you so much. Looking forward to have more of you join and do the master's program and also the postgraduate diploma. Thank you so much. Over to you, Sonia.
Thank you, William. Indeed, we will be organizing more events in future. And anyways, it will be informed to our participants and other audience as well. I have posted the link to download the certificate. Please download your certificate. And thank you so much for your presence, Professor Andy. This is always a help, and it is a really good session. Dr. Felix, thank you for your presence, and William, thank you for all your support from PHASOM. Thank you.
Okay, good night to all. And thank you for joining us today.